You're listening to the Doc Lounge podcast. This is a place for candid conversations with healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment. I am your host, Summer Gilbert, and I am the Director of Marketing and Branding here at Pacific Companies. Our co-host today is our Director of Locum Tenens, Mr. Brian Davis. Brian, I am so happy to have you here today. We are talking to Dr. Natalie Lambajian Drummund. Dr. Natalie, that is what her nickname is because she is a pediatrician. So that's what we're going to call her throughout this podcast. So Dr. Natalie is going to talk to us about how the pandemic affected her practice. And then also she's going to give advice for physicians and parents on how to deal with this because it's not over. It's still going on. It's better than it was. But we are going to get her expertise on this topic, and no one better to do this than Dr. Natalie herself. So thank you so much for joining us, and let's get started. So, first of all, Dr. Natalie, thank you so much for coming back on to the podcast. We're really excited to have you.
Thank you for inviting me. It's always fun.
And my co-host today is our Director of Locum Tenens, Brian Davis. Brian, thank you for being here today.
No, thanks for having me on. Appreciate it.
Today, we're going to discuss the pandemic and how it affected you as a pediatric specialist during the pandemic and then how it is now. So if you kind of take us to the beginning during the pandemic and safety protocols and all of that, how was it being a pediatrician in the thick of the pandemic?
Well, I have a slightly different experience because I'm independent. I make my own rules. So I chose to stay open the entire time. So I didn't miss a day. A lot of large medical groups, their medical directors made the decision to shut down and move everything to telemedicine. So my experience was a little bit different. I think what's interesting is that a lot of us, when we really think back, in January or February of that year, a lot of us actually had what we thought was influenza, although we kept testing negative for influenza. And we all kind of, it's pretty rare that doctors that have been in practice for a while get sick. We get a lot of immunity from all the exposures that we have. So when something really takes us down, we're like, what is this? So looking back, I'm fairly confident I had the original OG strain of COVID at the beginning of February before we started heading into lockdowns. And a lot of people that I've talked to in like the ERs and the ICUs all kind of had the same story. Pediatrics, we obviously are very focused on infection control. Most of the things that plague children are respiratory. So we do our best, but children kind of bust right through that. Just like a mom, a mom's badge of honor is kind of like snot on her shoulder, so you have to be, we tried very hard not to scare the kids. You come out in full PPE, a yellow gown and a mask and all of this, and the kids are like, "Oh my God, it's an alien!" And they're like running to the door. So you kind of, for myself, it was good hand washing, keeping my body strong, making sure I took care of myself, but still being there for my kids. So I can say I've had every single strain of COVID. So I've survived them all, and I used to joke and say, somebody needs my plasma, feel free, come get it. We saw a lot of people get really scared and just not want to leave their house because the media was so we saw a lot of kids missing their well child visits. We saw a lot of kids that had, things that should be very easy to fix if you catch early on, really suffer and not get that adequate treatment, that timely treatment, which was very, very sad. Here in Chicago, we had a teenager that passed away from appendicitis because his parents were too afraid to take him to the emergency room.
Oh no.
And so these are the things that on top of medical personnel dealing with the stress of the pandemic, we're affected when patients die. We are not robots. And so the stress level was just so incredibly high. Because also like people were not leaving their homes, we have a whole generation of young children now that have social anxiety. One of my best friends is an early elementary teacher, and she lovingly refers to them as the feral generation because they have no social skills, they don't know cooperative play, they don't understand facial recognition, they don't understand social cues. So there's a big backlog of development that needs to happen.
Mm-hmm.
So we're just getting to the point where people are coming out of their homes and really getting back into the doctor's office, and we're playing catch up. And so a lot of subspecialty lines, ENT, general surgery, they are so backlogged because they have 2.5 years of cases now that they have to get caught up on. So access to care still right now is still a problem. So we're working on it, and we're working the hardest. But you have to remember, when the pandemic started, just like in education, those doctors that were older and like more established and could kind of retire early, who are also at the highest risk for death and detriment from COVID, were like, I'm out.
Mm-hmm.
I'm gonna retire early because I'm not about to like put my life on the line. Then we also pushed out a lot of young graduates who really hadn't had a well-rounded education. So we got a lot of work to do. We have a lot of things to get caught up on.
And you bring up the appendicitis study or appendicitis death.
Yeah.
Do you think a lot of the children are affected by how their parents are reacting to this? So when they come and visit you,
how could they not? Yeah, absolutely.
It's all related to how the parents are reacting to the situation. They're making it way worse for the child.
Right. I mean, we have to try in periods of crisis to try and maintain as much of a sense of normalcy for our kids because they get scared, and you have to be very careful. We had a lot of adults that were struggling with their own anxieties, addictions. We had alcoholism and drug use go way out of control. Parents who were not used to being full-time parents were like, I am not prepared for this. I don't know how I'm supposed to work and parent and keep everybody. I literally had a father who came to my office because his wife was a nurse. So she was obviously working really long hours. He'd really never been a full-time parent. He honestly just needed an exam room to cry. He's like, I feel like a failure in my job. I feel like a failure as a parent. I feel like a failure in every aspect of my life. And I don't think I'm doing a good job anywhere. And he's like, I don't want to lay this on my wife who's on the front lines trying to actually combat this pandemic. And he's like, I don't know what to do. And I think, this is, we always talk about how it takes a village to raise a child. Well, we lost our communities.
Yeah.
We became isolated. And it was a really, really difficult time on so many levels. I mean, we're still unpacking all the damage.
Yeah.
That happened. I mean, obviously the pandemic was severe. We lost a lot of lives, but as happens a lot in pediatrics, the repercussions and the reverberations of those actions that we took were never really fully considered.
Mm-hmm.
And pediatricians were like, you can't take away kids' coping strategies. You can't take away their sports. You can't take away their friend groups. Teenagers are notoriously they're pack animals. So
yeah.
Did it surprise anyone when we saw spikes in suicide, especially amongst teenage boys? No, like we saw it coming. But it didn't matter, like we weren't being heard.
Mm-hmm.
And so again, it's nobody's right or wrong. It was a horrible situation. I would have liked to have seen a little bit more consideration on how this was going to affect kids. And right now, like our educational system is also kind of like stepping up and having to be a mental health system right now. They're also having to be physical, occupational therapists and speech therapists. And, it's gonna be years for us to get everybody back on track.
Yeah, there's going to be a long repercussion from what's going on.
Dr. Natalie, really quick, you mentioned kind of developmentally, kids were delayed. I mean, are you noticing a significant percentage of the kids coming in not hitting those traditional milestones? I mean, is it all the kids really, or?
Well, it's particularly like communication and personal social are where I'm seeing the biggest delays. And obviously the children that didn't have siblings were the ones that were impacted the most. Here in Illinois, our early intervention system did their very best, but they stopped doing in-person visits. It's really, really hard to provide speech therapy and occupational therapy services through a webcam. My sister's a speech therapist, and she's like, I can't do my job with a mask on. Children have to see how I move my mouth. That's part of the job. So there was a lot of frustration all around. But yeah, especially the children who, when they were entering the pandemic, were around 18 months to 2 years, which is when we're starting to move towards interactive play and group dynamics, turn taking. This is the development of empathy, the ability to communicate your needs. So those kids now are kindergartners, and God bless kindergarten teachers. God bless them. There's a special place in heaven where they get to live, because it's like herding feral cats, and they're amazing. But even they'll tell you their class sizes are bigger than ever. There's a lot of teachers that have left the profession. They don't have support. Everybody's scrambling. And who pays the price at the end of the day? Kids.
Yeah.
So the kids.
Absolutely. Now let's kind of move into the vaccine. So as a physician, you said that you kind of control your own practice, you have your own practice. So you weren't necessarily forced to get the vaccine, but I'm sure a lot of your peers were. How do you feel about that?
Well, I did take the vaccine because I still have inpatient privileges. And it was one of the, we kind of, all of us in medicine stepped up. We did our part. We knew, we knew this was an experiment. We had no idea how mRNA vaccines were necessarily going to affect us. We had limited data. But if anybody was going to experiment on anybody, let it be us. That's kind of where we all stood, I'm fortunate. I don't have chronic health issues or other things that you always have to take into consideration when you are kind of offering yourself up. So I did take that leap, and I took it, and I said, listen, I hope this gives a lot of really good data so that, the people that may have other comorbid conditions, like we can figure out what's the best way to control this pandemic. I think everybody was a little salty when it took legal action to release the data that kind of showed all of the side effects that were being reported with the vaccine. And, I, like, for myself, like, I knew I was jumping into something that we didn't know. Like, I went in with my eyes wide open. I'm a huge advocate for informed consent. I tell everybody, I'm like, I'm pro-vaccine, but I'm also pro-safety, and I'm pro-informed consent. And that informed consent is inherent to medicine, right? You have to make sure that you can explain any procedure, any medication, anything that you're doing, because this is the foundation of our healthcare system. And like I told you before, like, it's not about what I believe, it's about what they believe, and how do we answer all the questions, make somebody comfortable. That's the same whether you're giving them a vaccine or if you're taking them to the OR, right? And the trend that we're seeing that's a bit concerning is because so many adults are feeling lied to, with like the information was withheld. It's really making them question all vaccines. And so we're seeing a huge surge in non-vaccines. Like I said, I run my own practice. I have a lot of families in my practice who don't vaccinate or who do selective vaccination. This idea that one size fits all is never a good idea in medicine. I understand why, obviously we want herd immunity, we want these diseases squashed. But I think parents are at the point now where they're like, you're feeling a little upset, you're feeling a little lied to, they are feeling a little insecure about their ability to trust the government's protecting of their interest. And the virus has mutated to such a mild strain where there's very little morbidity and mortality for children. They're like, well, exactly why should I offer up my child at this point? I'm like, we have very little safety data. And, like we talked offline, in order to bring a drug to market, it requires a really long safety surveillance period.
Yeah.
And we've had vaccines that have gone through this whole vetting. There was a vaccine called RotaShield that was for rotavirus that had gone through full FDA approval and had been on the market less than a year. And there was all these case reports of intussusception. And we sounded the alarm as pediatricians and said, we're going to yank it from the market, reinvestigate it for safety. And then it came back as RotaTac, or like a different vaccine after they reinvestigated for safety. So I think right now a lot of parents are like, hey, I'm not sure anybody has my best interest at heart, and they are taking it upon themselves to like, I want to know the data. I want to read about all these vaccines. And it's very confusing because there's a lot of different voices out there. They don't know who to trust. And normally that person should be your doctor.
Right.
Yeah.
They're even doubting their employed doctor who is being told what to say.
Yeah.
And that's a problem.
And sometimes they're stopping kids from being able to go into a group if they're not vaccinated.
Oh, we're seeing a lot of the large medical groups here firing patients for not vaccinated.
Oh.
So I didn't start off having a solo practice where I had a large number of non-vaxxers, but I personally don't feel like if you have, I approach my relationship with my parents as collaborative. I'm not their parent. I'm not a dictator. My job is to explain the data, to explain why it's in their child's best interest to be vaccinated, if it is in their best interest. This idea that vaccines are 100% safe. Like, I went to Washington, D.C. to discuss vaccine safety. And I remember when I pulled into Washington, D.C., there was this huge billboard that said vaccines are 100% safe, period. No, you cannot say that. You can't say that.
No.
That is a lie. You can have an allergic reaction to Motrin,
Yeah.
And so I feel like we've stopped having educated and collegiate conversations about how we can make things better. So one of the things that I challenged the senators when I was talking with them about was pull the DTaP insert. And I said, okay, let's take a look at the clinical data. And in the DTaP insert, it said there is a 0.09% neurological complication. You multiply that by 30 million children in the US. Where are all those kids, right? And so I said, I challenged them. I said, I want you to go back to your states. I want you to call your government office, the VAERS reporting system, and find out, are the number of cases being reported to VAERS meeting at least the threshold that the pharmaceutical company reported during the FDA approval process? And I got calls from many senators. They're like, you're right, did it. So where are all those kids? And I said, well, that's the problem. By denying that there could possibly be like an untoward effect from a vaccine, creating this culture where nobody's allowed to talk about it, nobody is allowed to report it. We've stopped the discussion, we've stopped progress.
Yeah.
I think vaccines are one of the greatest medical inventions of the last century. But are they without risk? Absolutely not.
Yeah.
Vaccine injury happens. It happens. That's why we have a fund. We have a federal fund to pay out for that.
And I'm not anti-vaccine, but for those parents listening, what would you tell them about getting their child vaccinated, and at what age?
I mean, are you talking specifically COVID vaccine, or are you talking all vaccine?
COVID vaccine specifically.
Well, my job, the way I approach it is I am your child's advocate. I have to meet the threshold of first do no harm. That's the very first vow that I took in medicine. And I was hesitant. I said, no, I'm like, until you show me the data, until you can tell me that this is safe, I'm like, you're not giving it to my patients. Like, I refuse to support it. And the AAP had their very first webinar, Wednesday. where the medical directors of Moderna and Pfizer started presenting the data. And the data is limited. We have less than a year. We've got mainly a Caucasian representation in our sample size. I'm not, like I said, it has nothing to do with whether I'm pro or anti-vax. It's about, let's look at the science. The science is just not there yet. And what really makes me angry is I've lost children to cancer. And there have been like medications and treatments in the FDA approval pipeline that could have possibly been life-saving. We don't know. And parents were begging. They're like, listen, my child is going to die anyway. And if this could possibly save them, let's try it. If it doesn't, this is going to give scientists really good information so that they can maybe fight cancer. I remember President Trump in his State of the Union address said he was going to work on kind of cutting through that red tape. So I was kind of frustrated. I'm like, how is something that right now where COVID has been fairly mild with children and like this somehow like rushed right through the pipeline, and we've got children dying of cancers all over the US saying, hey, we want those drugs that are being in development. And they're like, nope, we need 5 years to monitor for safety, And so you're getting, the parents are getting these mixed messages, and I'm like, the good news, parents are re-engaging and starting to think critically. What's sad about that is that they can't expect their doctors to do that for them, which is what a doctor is supposed to do.
Dr. Natalie, how are you addressing when a parent comes in, the healthy child, 4 years old? How are you addressing when they're asking questions like, are there long-term side effects? When, like you said a moment ago, we don't truly know. How are you, as a practitioner, saying that?
I literally, if you ask any of my patients, I will tell you I'm nothing but I'm very honest and transparent. I'm like, we simply do not know what the long-term ramifications of an mRNA vaccine are. We just started injecting them less than a year ago. And pediatricians, you ask any pediatrician, they'll always tell you, children are not little adults. They have different physiologies, they react differently. So when you try and extrapolate adult data down to pediatrics, it's not in their best interest. Again, this has been highly argued even amongst ourselves, in our doctor lounges. Like we're all, everybody feels very strongly about this. So it's not an easy decision. But I was telling you that I had somebody who's like, well, this was like the polio epidemic, right? Like, no, it's not, because children were dying from polio. They were in iron lungs. They were paralyzed. They were permanently damaged. Right now, the BA.5, which is kind of the predominant strain in our area, has been a day of like mild fevers and a runny nose. So parents are like, no, I'm not sure I'm ready to take that leap of faith when the symptoms are so mild. And, I think we have, as far as our patients having faith in us, in the government, in the approval process, we just step back in time about 20 years. And we're seeing a huge resurgence of people now declining all vaccines, which is going to be very dangerous moving forward.
Are there any kids in particular, immunocompromised, kids with respiratory issues that you would, obviously the long-term data isn't necessarily there, but are any of these kids specifically kind of prime candidates? Maybe they want to consider it more so than another child, or are we just not there yet?
Well, we typically talk about, the two ends of the lifespan. The very young and the very old are always the most vulnerable to any type of infectious agents. So a lot of the kids, from my understanding, at least, again, limited data, that succumbed to COVID had a lot of comorbidities. We had a couple of preemies in the NICU here in Chicago that lost their lives to COVID because they had really bad lung problems, things like that. So like when Delta was a horrible strain. That was when they kind of preyed on a lot of those vulnerable kids. But I have two children right now, they're on vents and they're vent dependent and they have very complex medical histories. Both of them have had now COVID twice because home health nurses have brought that in unbeknownst to them, because a lot of times they're shedding virus before they're even symptomatic. what was interesting is both of the kids we ended up admitting to the PICU just for monitoring, they seemed to sail through it. Both of their mothers ended up in the hospital.
Mm-hmm.
It was the parents that actually, and they were both vaccinated.
Wow.
So it's hard to, again, it's kind of hard to say, at least in my pediatric community, that the typical rules that usually hold true, like, okay, you have chronic disease, you're immunocompromised, it didn't really seem to be the same.
Yeah.
So, obviously again, it's always weighing your pros and your cons. People have forgotten, business has forgotten that medicine at its core is an art, not a science. We talk about the practice of the art of medicine. It's about knowing your patient, their individual characteristics, looking at everything in, not in protocols and pathways and all of this, but what's going on in this particular situation and how do I think critically about this situation and make the best decision for my patient.
Yeah.
So, I have children with Rett syndrome. I have kids that have chronic lung disease. That is a really difficult decision to sit down with parents. A lot of my parents opted to not vaccinate, but to homeschool and kind of segregate their kids.
Mm-hmm.
We're just not willing to go there just yet.
Yeah. This is a very important subject because this is new, having this available to children.
Yeah, like I said, for any new treatment, any new medication on the market, any new vaccine, I always look at it through the lens of, does it meet the threshold of the very first vow that I took in medicine, which is to first do no harm? And it doesn't matter whether it's the COVID vaccine or a new medication that's on the market. If I'm just not there, I'm just not there. Now, this is why it's important for drug reps and pharmaceutical companies and CME companies to be able to educate us to try and get us there, right?
Mm-hmm.
It was radio silence this entire pandemic. Like I talked to my friends who are pharmacists, they were getting injections that had no package insert. And even pharmacists were like, we're very uncomfortable about this. Like we're injecting things into arms and we don't even have a package insert or data to look at. We are also scientists, and it's our job to read the science, digest the science, and explain the science to our patients. And there kind of was this paternalistic approach, like, oh, well, you need to they respect you. And so therefore you need to tell them that they need to do this because it's what's best for them. And you just have to take us on faith. And I'm like, yeah, that's not my job. My job is not to take you on faith. My job is for you to tell me the science, and then for me to decide whether or not I think it's a good option for my patient.
Yeah. Are you seeing side effects now that it is available?
I had two my teenagers who developed myocarditis after receiving the COVID vaccine.
Okay.
And again, we still don't understand why that happens. And some of the most compelling research is coming out of Europe. So I have to say the Israeli health ministry Israel and Germany really impressed me through this whole pandemic. Their health ministries have been amazing. They've been very reactive, very involved, very transparent. So most of the data that I've been watching has been coming out of those two places.
And these were boys?
They were both boys. They were both healthy athletes who started experiencing kind of like shortness of breath, and they kind of described like a heaviness to their chest. Okay. So they did develop some myocarditis. Now they are recovering, and just like they did say, most of the kids typically recover from it. But what really bothered them is they were out of play. They weren't allowed. These are kids that sports is their world, and then now the cardiologist is saying, sorry, you can't participate in sports for the next 6 months. And they'd already kind of like, people don't understand that those sports are their coping strategies for life. It's more than just a game for them. Like this is how they work through their stress. This is their social connection. So it was a huge hit to their life, and they were very depressed, and we had to work through a lot of mental health issues after that. When I'm like, sorry, the cardiologist says you can't play. Mm-hmm. And we don't understand why did two healthy boys develop this?
Yeah.
Those are the questions.
How old were they, if you don't mind me asking?
One was 16. The other one was 17.
Okay.
Yeah.
Yeah.
And one of them
Gosh,
was
that's scary.
he was a star athlete. He was trying to get his scholarships. He got pulled from play. So he really had a hard time.
Mm-hmm.
No. So
Yeah.
that's the
It's
thing.
scary.
So yeah, there is no right or wrong, like life exists in the shades of gray.
Mm-hmm.
This is where we need to have open dialogues, not only amongst ourselves, amongst scientists and health professionals, but with our patients. And we have to be honest and say, yeah, look, we don't know. We need to weigh the pros and cons in your situation. And we have to make an educated and informed choice.
Yeah.
And we then live, when we've done that and we've met that threshold, there are consequences. We deal with the consequences with clear conscience. And I think a lot of parents and patients were like, yeah, nobody warned me this could happen. And I blindly walked into this. And now they're angry. And now I'm having problems getting my college students to take their Men B vaccine, which is absolutely necessary if they're going to be living in dorms.
Yeah.
And that's again another tragedy.
Yeah.
Are you finding that on kind of the other side of that spectrum, the people that come in and are saying, yes, I want my child to be vaccinated, specifically for COVID, are they asking the same questions? Are they kind of as detail oriented with their fact finding on that, or are they just saying, let's do it, let's move on?
So a lot of my families that were early volunteers basically are now coming to me going, oh my gosh, do we need to do an echo? Can you do an EKG? Like there were pediatric practices that wouldn't clear kids for sports who had received the COVID vaccine unless they did an EKG. And I remember calling the AAP going, are you guys going to comment on this? Like, like we've already talked about how doing routine EKGs on all athletes was not it was not the right thing to do based on the data that we had looked at. But now does that recommendation change with these concerns with myocarditis? When should we be monitoring these kids? How long after should we? Again, everybody was like, oh, we don't know. So we had some pediatricians that took a more defensive stance and they're like, listen, I'm going to check everybody's heart that had it. And then there are others like, well, if you have symptoms, then we're going to check. So again, there was just this kind of mass confusion. So rolling out a whole program without kind of educating the people that are supposed to get informed consent, to me, felt really off. Just felt off. So when they asked if my site, like my clinic would be a site, I was like, no, not there. Not there.
Yeah. Okay. So you guys aren't, at your clinic, you guys aren't giving vaccines, right? At this time?
Not the COVID vaccine.
Yeah.
The state of Illinois, again, I can't talk about other states, and this may have changed, but part of, and when you decided to be a COVID site, it was mandatory enrollment in a program here in Illinois called the iCares program, which basically allowed the government and the state to get into your patient's charts to look at their vaccines. And that to me was a HIPAA violation.
Absolutely.
Circumvented HIPAA. And I'm like, yeah. I can't enroll in iCares without all these patients individually saying, okay, yes, you can have access to my chart. So I was like, no, I'm sorry, not doing that. My patient's privacy is very important to me. And so I was like, so the patients of mine that wanted the COVID vaccine didn't get it in my office. They went somewhere else. And that was, again, another important thing. Like, I understand we are in an emergency use. I understand we're in a pandemic. That doesn't mean I have to throw HIPAA out the window.
No, yeah. And I always wonder that with employers and certain situations where they're like, you can only do this or you can only work here if you have your vaccine. And to me, I was like, well, isn't that, and I haven't read all the papers. I'm, I don't know.
A lot of pending
HIPAA.
lawsuits.
Yeah. And so that's definitely, as a physician, asking someone that is a HIPAA violation.
Right. It's just like, oh, have you ever been treated for an STD? How is that relevant to me doing my job?
Yeah.
It's hard. I understand, when it comes to health departments and government policy, we have to also think about, the entire society as a whole. I understand that. But where does personal freedom and where does responsibility for the rest of the world come to play? A lot of my families who don't vaccinate have been really persecuted. A lot of their argument is like, well, if your vaccines work, why do you care if my kid's not vaccinated? Your child's vaccinated, your child's protected, right?
Yeah.
So, there's just, again, like many other things in this country, the divide is happening.
Yeah.
And that scares me. We need to be able to have dialogue. We need to be able to talk to each other, not yell at each other, not hate each other, point the fingers. None of that has to end. It has to end.
Yeah. Brian, as a recruiter, are you noticing, because I've been noticing doing some of the marketing for you guys, that some of the facilities are saying, COVID-19 vaccine required. Are you seeing a lot of pushback from your physicians or no?
A mix. A lot of the providers, when things first started, they had the early access to the vaccines. And so a lot of them did get vaccinated. There was a good number that held out. They have given multiple different reasons. And unfortunately, some providers that don't believe necessarily just in the science of it have been forced almost sometimes to resort to other exemptions, you know what I mean? And leaning on, be it religious exemptions or anything else, because the healthcare organizations really are enforcing it and requiring it. And more of those exemptions, even as time goes on, are actually disappearing. You would think it would be the opposite, potentially, that there'd be more reason that people could have exemptions for it. It's actually quite the opposite. They're just really cracking down, saying you are not stepping foot in this hospital unless you are vaccinated as a provider.
Well, and you have to remember, we're also living in an era where we can disseminate information so much more readily. So we had ICU nurses who were refusing to get vaccinated, being marched out by security, filming it the entire time. You had police officers being told that they couldn't report for duty, and it's all out on social media and TikTok and Instagram. And, so it really is a very different age right now. Again, we just weren't ready for this. How this was going to really go down. And I believe that your body is your own. You have the right to put anything to do to it, whatever you want. And, this idea that if you don't do what you are being told to do, like, are we going to start firing diabetics who eat cake? Or the guy who has asthma that chooses to smoke? Where does it end?
Yeah. And I understand, as a healthcare provider, because you're around certain diseases, that yes, you should take vaccines. But those vaccines have, like we were talking about, took 10 to 12 years of studying and testing before they became available to the public and approved by the FDA. And now we're changing the rules, and we're making people get something was brought to market in less than a year.
Right. And there were early studies, like Israel's doing a study looking at how the mRNA protein was coming out through the ovaries. So there was concerns about reproductive issues. A lot of women that were in medicine were like, listen, I'm trying to have a child. We have no idea what this does. I'm not, pregnant women were always hands off. You couldn't even give them Tylenol without talking to the OBGYN, right? I used to moonlight in the ER. Like, you had to, once they were pregnant, it's like they were off limits, So all of a sudden they're like, oh, no, you need to take this. Like, what? Wait a second. Where's the safety data? Is it category C? Like, how do we know it's a category C? It's just kind of like that kind of safety rating. And I talked to a lot of my OB/GYN friends who they themselves had concerns, and they were like, yeah, but we're being told by our medical directors that we're not allowed to say no.
Yeah.
And that, when doctors are put in an ethical conundrum, they don't react well because we are bred to be leaders in our community. Unfortunately, I kind of feel like that trend is changing, which kind of scares me a little bit because there's this whole checks and balances that's inherent to the system that is kind of being disrupted. And at the end of the day, the people that are going to, the patients will suffer.
Yeah.
You know?
Brian, as a parent, what's your biggest concern? What's one of your biggest concerns about your children and this COVID-19 vaccination?
I think there's two things really. I mean, I think one, we've been through it now. My son's going to turn 3 years old next week. He's been enrolled in daycare the entire time, just a cesspool of germs of any sort of thing. And I think that because he's been in it for 2 years and he's thankfully never tested positive for COVID, he's had normal, colds and whatnot. My concern is at this point, does he need it? He's gotten through the first 2 years. One, does he need it? And two, do we know the long-term effects? Given the fact that he's been 2 years, he's done fine and whatnot. Those are probably my two things. And Dr. Natalie, I think what you touched on earlier about informed consent. I think, when I go for that 3-year-old checkup, I mean, it's just about asking questions. I think that's what's most important for parents, right? And really understanding what's best for your kid, I think is what I'm hearing you say. And people can make the decision at that point, right?
I 1,000% agree. Well, and here's the other thing too. So there was some preliminary data when they contact traced, I think it was Finland, I'm remembering correct, where they couldn't find any transmission from a prepubertal child to an adult. And they talked about how it appeared that the viral load in children was much lower and that they didn't aerosolize, right? So that was kind of like, okay. So is your son testing negative because his viral load is low and therefore is under the threshold of our detection test? Because if I were to draw blood on him and look for antibodies, would I find antibodies even though he never tested positive? And I have a lot of kids whose parents were like, I want to check antibody status before we consider vaccinating, who never tested positive, but when I checked their antibodies, were robust antibodies.
Yeah.
So
it's interesting.
So that's another option. Again, I'm very grateful. I have a very educated and engaged patient population. I'm one of those doctors. I love it when my patients question me. I'm like, challenge me. Let's get to the answer together. There is a lot of doctors and there are a lot of institutions where that is really not treasured.
Yeah. Gosh. Well, thank you so much for educating us. I mean, and it sounds like you're still being educated daily on what's going on.
I tell my patients, I've been an active student my entire career. I've got like more degrees in my account. And the more I learn, the more I realize I know nothing. We know nothing.
Yeah.
The more educated you get, the more you realize, my gosh, there's so much to know. And we don't know so much. So just got to be honest.
Yeah. And kind of an ending, what would you tell parents right now, how to react and how to help their kids get through this time?
I think first and foremost, I think you need to make sure you as a parent are in a good place. We have a lot of parents who are suffering, like I said, from addiction, anxiety disorders. You can't hide that. You can't, when they talk about, you can't be an effective parent unless you yourself are also taking care of yourself. Like put that oxygen mask on first and then go ahead and put it on your child. So we really need to help our adults kind of recover so that they can be effective parents. Second of all, particularly my parents who have children under the age of 5, I'm asking them when you go to playgrounds, kids are going to hit. They're going to fight. Please be mature, model good conflict resolution skills. Don't get into a fist fight with the other dad because that child pushed your child down. So I'm seeing bad behavior on, in adults. We need to model behavior to help our kids get through this. We also need to meet kids at a place where they can understand. Let them ask questions and answer them appropriately based on what they can understand. When you hide things from kids, they catastrophize in your head. So they make it a lot worse. We're going to have to coach kids through their anxiety, which means we need to push them a little out of the nest. Go engage. You're going to be fine. And it's hard.
Yeah.
It's hard when your child is struggling, but you need to be strong and you need to make them face that fear and see everything's okay. Go out and play in the playground.
Yeah.
And the other thing that I would tell parents is like, please don't throw the baby out with the bathwater. Like you have legitimate concerns about the COVID vaccine. So do a lot of us. And we are getting that information and we're digesting the data as it comes out. But that doesn't mean that your child doesn't need a tetanus shot. That doesn't mean that your child doesn't. I get asked a lot as a pediatrician, like, which vaccine is really, really, I'm like, well, from a worldwide perspective, they're all important, but I practice primarily in an agricultural community. I'm like, you don't want to not have a tetanus shot and be on a farm. You just don't.
Yeah.
So please don't please stop everybody jumping to these broad conclusions, these generalizations. Let's just treat each other with grace and compassion. Let's start having good conversations. And we're going to show this next generation that we can work through it as adults with good communication skills and the ability to disagree and still be a community.
Yeah. Do your research. I think there's such conflicting information that no matter what my stance is politically, I listen to both sides.
Absolutely.
So that I can come to my own conclusion.
Yeah. I had a dad who told me that was like, I did more research on the car I bought than I ever did on the vaccines for my child. And he's like, now I feel like I'm going back and having to all these different perspectives.
Mm-hmm.
And he's like, I'm really more confused and I'm asking you to help me. Like, what is in the best interest of my child? And that's where I'm like, well, your child is healthy. There's no family history of any vaccine issues. There's no chronic disease. I think we should move forward.
Yeah.
Yeah. It's going to be a really interesting next decade.
My last question for you, do you think masks are still appropriate right now?
So I have gone on record. I am not a mask advocate. I never have been. I tell everybody, I'm like, that's like wearing a mesh condom and then getting upset when you got pregnant. Viral particles can go through a cloth. They can go through a surgical mask. I worked alongside the Navy, and if you're dealing with a respiratory pathogen, you need an N95, you need a tuberculin seal so that those respiratory pathogens cannot get in. I don't personally feel that the developmental hit that children took from wearing all these masks was worth it. And I see the mask that these kids bring in, they blow their nose in it.
It's disgusting.
They're trading their masks with the other kids in their classroom.
I'm
like, if you really are asking children to be model infection control agents, I'm like, we've got healthcare workers that aren't even wearing masks properly.
Yeah.
So I really don't feel like that was the answer.
Yeah.
And in medicine, we mask the sick, we don't mask the healthy.
Yeah.
So I really, really, really hope that we don't go back, to a mask mandate.
Me too.
I just really don't think that it's in the best interest for our kids.
Yeah, I agree. Well, thank you so much for your information and for what you do. And for those of you that are listening, Dr. Natalie did do an amazing story about a crazy case, a neurological case, and it was incredible. It's one of our top listened to. So you can go back and listen to that. So let us know if you have any more interesting cases like that. But for right now, for what we're going through, what our world is going through, I think this was an important conversation. And Brian, thank you for jumping in for someone who has, young child, and it's so important to ask those questions. And every doctor is going to have different answers, but I appreciate you taking the time and giving us your feedback.
Absolutely. And thank you, Dr. Natalie. It was a good conversation.
There was one thing I wanted to touch on that we didn't get to, and this is something that Brian and I were talking before. If you really want to talk to a pediatrician and what makes them kind of quake in their boots, that's RSV, right? RSV has killed infants left and right for decades. We didn't mask up all of our adults who only have a mild cold in order to save all of our babies who are dying from RSV.
Yeah.
And so I'm actually, as a pediatrician, really concerned about the RSV season. There was a couple of infectious disease doctors that came out and said, RSV's been absent now for 3 years. We now have 3 years of children who have no immunity to RSV.
Wow.
What is that going to look like in the fall if RSV comes and is virulent?
Wow.
So we, as a pediatrician, I'm bracing for impact of RSV season more than I am COVID. RSV, when you see a child on a ventilator, like literally drowning in their own secretions, when you're feeling very helpless to do anything. And where's that vaccine, right?
Yeah.
We have Synagis for preemies, but where is the routine vaccine to get rid of that?
Mm-hmm.
Because that affects way more children every year. And in a much more detrimental way with chronic lung disease and scarring.
Good point. Yeah, that's a great point.
So I hope to challenge the pharmaceutical company. Hey, can we get on that?
Yeah.
Can we start working on that? I'd like to see that go away in my lifetime.
Yeah. Any advice to other pediatricians listening to this?
I think pediatricians need to go back to their roots and remember who they work for. I tell every parent, I'm like, I don't work for you. I actually work for your child. You may pay my bills, but it's your child's best interest. And they are the one that is the center of every decision that I make. And pediatricians, just like citizens of this country, have to get re-engaged, re-involved in the process. They need to get their voices heard. They need to not be afraid of losing their job or their license to bring up things that they see that are concerning them, because at the end of the day, it's okay to even bring up a concern and be wrong. You still need to bring up the concern so that it can be investigated. Because at the end of the day, this checks and balance system keeps our kids safe.
Yeah.
So I think we're going to see a huge precipitation of physicians out of employed positions back into independent practice, because they realize, oh my gosh, when I took this job, I didn't realize I was trading on my ability to be an advocate and being told what to do to keep my job.
Yeah.
So I really feel like we're going to see a decentralization. As much as the large groups are trying to buy up everybody and bring everybody together, I think that diversification is going to happen.
Yeah. Yeah. All right. Well, thank you so much.
Always nice talking to you.
Thanks, Summer.
Okay.
Nice to meet you, Natalie. Bye.
Bye.
Thank you to all our listeners. If you'd like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast could not be possible. If you would like to be a guest, go to www.pacificcompanies.com. Thank you.